and from the other parts of Luzon. I am hoping that everyone is doing well and fine and everyone is ready to learn in today's session. So today is also a special day because it's not just about Arts Month, but it's also about science. So tayo, pwede rin sabihin natin pagbabahagi ng isang medical doctor about arts and the medical field. This is a very interesting topic to be in, and I'm so happy that there's a lot of us who are interested to listen for today's discussion. Before anything else, I would like to say hi to those coming from National Teachers College. Hi po, dyan sa inyo. From UP Cebu, I know a lot of individuals from UP Cebu are tuning in right now. Hi po, galing sa Baguio City. Good afternoon po. And those coming from Pangasinan. Thank you po sa pagdalo sa ating munting pagbabahagi ngayong araw. And before we start, we officially start our discussion, Heart Talks for today. Our collaborators for this particular series with the UP Cebu TLRC is the Makisining, the Makiling Art Group. This art group, Makisining, is a collective of professional and amateur visual artists, student artists, and art connoisseurs based or practicing their arts in one of the 6 municipalities and cities in the foothills of Mount Makiling, namely Alaminos, Bay, Calamba, Calawan, Los Baños, and Santo Tomas. But starting 2020, Makisining is opening up its reach towards other individuals and artists from different parts of the Philippines. And right now, collaborating with UP Cebu is one of the ways that Makisining is trying to reaching out to all of us to tell about their stories and to join us in being aware of art, not just in the Philippine context, but in the context of the global world. Okay, thank you so much everyone for being here with us for our webinar netiquettes and also the introduction of our speaker. Let's call on the new TLRC coordinator, Sir Fernan Bernardes. Sir Nan?
Yes, good afternoon, Miss Jara. Good afternoon, everyone. Allow me to share my screen for the meantime. One moment. Okay, so hopefully you can see my screen. Good. So these are the webinar reminders. First, this webinar will be recorded, so we will be keeping a tab on the proceedings for this webinar for documentation purposes only. You're also free to leave if you feel uncomfortable that this session will be recorded. Also, these are the webinar etiquettes for us to note. First, mute your microphone during the talk. We want to make sure that the speaker's voice is clear to everyone, and we may opt to remove you if you don't follow this request. Second, refrain from taking photos or videos of the talk. If you do so, you will be held accountable of data privacy violations if the copy you created leaks into other internet outlets, and we wish to keep the identity of our participants private, so as yours as well. Third, avoid using annotation tool. Once the annotation tool is actually activated here in Zoom, you might unconsciously do something on the screen while the speaker is actually presenting. So this may cause also a distraction to the participants and also to the speaker. Also, if you have any questions while the talk is ongoing, you may put them in the Q&A box in Zoom, and later on, me and Miss Jara will answer all those questions. And don't forget to evaluate. Your inputs on the webinar will be helpful for us to improve our next webinars here in TLRC UP Cebu. So please do not forget to evaluate. So after you have answered the forms, you will be given a proof of participation. So evaluation link will be opened right after the webinar and shall remain open for only 10 minutes. And also, did you know that this webinar session, it's also live streaming in our YouTube channel, which is TLRC UP Cebu. For those who are watching through YouTube, you will also get your proof of participation by staying until the end of the session. And we'll be announcing the instructions at the live chat, so please stay tuned. And these are our socials, or these are our social media here in UP Cebu. We have here for our Facebook, Teaching and Learning Resource Center, UP University of the Philippines, Cebu. We also have our YouTube channel, TLRC UP Cebu. We also have our website, tlrc.upcebu.edu.ph. And lastly, you may email us for any other concerns by contacting us here in lrc.upcebu at up.edu.ph. So I think these are the reminders that we need to take note. But before anything else, allow me to turn on my video. Okay, there you go. Sige. Okay po. So I know that Ms. Jara also shared earlier that after the webinar reminders, I'll go ahead and present to you guys our speaker for this afternoon's event. It is actually my honor and privilege to introduce our esteemed speaker for today's event, Dr. Nico C. Sidicol. He actually completed his residency training in family and community medicine at UPPGH from 2021 to 2023. He also holds a master's in public management major in health systems development from the Development Academy of the Philippines from 2015 to 2017, and a diploma in international health from UP Open University from 2019 to 2021. Dr. Sidikul, our speaker this afternoon, has a rich background in public health, having previously worked under the DOH Doctors to the Barrios program from 2015 to 2017. And also, he also served as a rural health physician at the local government unit of Calauan, Laguna from 2017 to 2020. His interests include community health, community medicine, public health, as well as visual arts, music, and writing Tagalog short stories. So please help me welcome Dr. Nico Sidicol, MD, MPM.
Good afternoon po, Doc.
Hello, good afternoon. So thank you for that introduction. So let me share my slide. Ayan, can everyone see my slide po?
Yes, Doc.
Clear naman or kita ba yung presenter view ko?
Yes po. Kita po yung for audience view.
Presentation. Again, I'm Dr. Nico Sedicol, and this afternoon, I will be presenting to you an advocacy on how we can utilize art to achieve better health for all. So I also entitled this session, When Systems Fail, Everybody Ails, because as a premise to this presentation, we want a more systemic approach on this topic and make use of art as a powerful tool in increasing awareness on what was happening around us, especially in health. So on behalf of Makisining Art Collective, thank you for UP Cebu TLRC for organizing the event. No? So I declare no conflict of interest, and I am not in any way affiliated to any pharmaceutical companies, agencies, or organizations that promote medicine and drugs. And I am not a recipient of any grant, scholarship, or any honorarium or incentives. And what I will be presenting are based on my personal experiences perceptions, and introspections which do not represent the institution I belong. So for the next hours, I will be presenting the role of arts in medicine in achieving better health for all and describe the sample artworks and its social relevance. So my motivation to start, I'll first discuss siguro yung motivation natin no, to pursue this endeavor stems from my experience as a community medicine practitioner wherein art has been used as a tool for healing, such as those using art therapies. Pero those are based on the recipient's view. So in this picture, no, we are teaching those Marawi siege soldiers for art therapy. And on the other hand, my motivation also stems from the fact that art can be used for personal wellness program to reduce your own stress from a day's work. And it can also be a source of income for some depending sa goals natin. Or it can be for your personal release or expression to reduce yung inner tensions within us. And ito ay based naman sa personal or the artist's view sa atin. No? So those motivations were mainly individualistic in nature. And there can be many reasons for this. But I realized at the end of the day, is there a role for art to improve the health status of every Filipino on a larger scale? In other words, can arts, specifically for this talk, I am pertaining siguro to the more on the visual arts, but it can be in any form of arts naman. Can it be a tool to impact health on a larger scale? And if so, how? So if all artists siguro collaborate to make health as the center of their advocacy, can we achieve health for all? So that was the question on my mind. So before I present the process and the framework, I want to share the concept of health for all. So this is the basic principle which I hold dearly as a medical practitioner. And this is the Alma Ata Declaration. This is a document that calls for an urgent action to protect and promote health for all by prioritizing primary health care, which should be the forefront in making health policies. So in short, health should be at the center of all of our policies and programs in the country. And moreover, this is anchored on the fact that health is a fundamental human right. And when we say human right, everyone should be able to experience that right, right? Pero let us ask ourselves now, is this really happening now? So probably not. Health as a fundamental human right has been the battle cry since then, and as of present, we are still witnessing many Filipinos with poor health status. And imagine this has been started since 1978 and until present, problems in health continuously rise. As for the reasons, there are multiple factors bakit hindi pa din natin ma-achieve ang health for all. So the Declaration of Alma Ata in 1978 also recognizes the fact that there is gross inequality in the health status of the people. Kaya mayaman na bansa or developing countries, there is gross inequality which is rising. And these were driven, according to them, by political, social, and economic issues that are unacceptable. So ibig sabihin, ang health ng tao ay hindi lamang dinidikta ng pagkakaroon natin ng sakit. So it's like an equation. Health can be summed up by political, social, and economic instabilities. And we are treating them most of the time, these factors are treated in silos, meaning without realizing that there is a complex interaction within those factors. And kaya it grows deeper, kaya lalo tayong lumalayo sa fundamental fact na ang kalusugan ay karapatan ng lahat. And true enough, when we say health, it is the state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So this is the definition by WHO, and I want us to focus on the social aspect of that well-being. So it connotes that health is not about just the physical manifestations. There are so-called social determinants of health. And for instance, probably we are already aware that many people easily obtain antibiotics from counters and sari-sari stores. We know for a fact that antimicrobial resistance is already increasing and more antibiotics are now no longer able to fight certain diseases. Pero magtataka tayo, bakit nasanay ang tao sa paghingi ng antibiotic? So are we educating the Filipinos or are we tolerating and allowing that loophole in the health system na hirap tayong mag-monitor ng health activities and agenda ng mga tao? Or na hindi na kaya ng sistema na palakasin ang primary healthcare ba para hindi malihis sa landas ang tao? Or do we really understand the way our fellow Filipinos think as regards their disease? So madaling sabihin kasi lalo for us at the medical field, madaling sabihin na ang antibiotic po ay hindi basta-basta iniinom. Pero sa isang banda, sa isang taong kapos or mahirap, ano ang pagkakaintindi niya sa gamit ng antibiotic? Masisisi ba natin sila? So ganon. So those social determinants are also important, such as those yung poverty, education. Those are important for us na ma-address in order to achieve health for all. And also included in the said document is the role of the government in providing primary health care. So when we say primary health care, it is the essential health care made universally accessible or na-access ng mga tao by the right person, right place, at the right times. And again, I emphasize here the role of the government. So in this picture, I was able to interact with the Aita community in Bataan for almost 5 months in total. Here, access by Aita community to healthcare is difficult, leading to the various pediatric diseases or illnesses. Pero if walang magsasalita para sa kapakanan ng mga katutubo, paano nila ma-exercise yung sinasabi ko kanina na right to health? So they themselves are confined to the mountains. And I remember one time, I asked the Aita children how many of them had worms in their stools or sa dumi nila. And almost all of them raised their hand as if it has been a normal thing for them. Even the elderly have parasitic infestations. So my point is we must make sure that the government is aware of the status of its constituents regardless of creed, gender, religion, etc., race, within its territorial jurisdiction. Hindi pwedeng may pinipili lang tayo na seserbisyuhan. So halimbawa, yung mayayaman lang na nakaka-afford ng private hospital, sila lang ba ang pwedeng piliin na tulungan? So ganon. Those were my motivations in order to pursue this field. And speaking of private hospitals, there are more private hospitals than public ones. So the government must be aware that setting up more private hospitals is not the way to achieve universal health care. So we keep on hearing yung universal healthcare. With that, we are giving the public kasi a false hope na may itatayong ospital sa tabi ng mahihirap pero di naman ma-access ng kapos-pera. So how do we let the government realize this fact? Parang sigarilyo lang, alam natin na alam ng government na nakakasira sa health ang sigarilyo. Pero dahil malaki ang nakukubra sa industriyang ito, patuloy itong poprotektahan. So now, as a regular citizen na may alam sa visual arts or any form of arts, can be music, can be writing, poetry, this may be an avenue or another dimension to see art and its role in changing a system or in system change. Maybe it's time to change our mental schema on how we view things and integrate arts for that matter. So I also want to briefly discuss to you the WHO health systems building blocks now in order to reframe your mind, especially if we have artists in the audience or interested in art appreciation, and probably allow these blocks to become integrated into your art world for those who are into arts. So in every activity, program, concept, knowledge, or events related to health, they can be classified under these building blocks. So for instance, poorly implemented health policies can be lumped into leadership and governance. Poor access and service such as low immunization coverage can be grouped under service delivery block. And poorly allocated budget, for instance, problems in pooling of funds, reimbursements and payment of your healthcare workers in the hospitals, they can be categorized under health financing. So, and lastly, the very high brain drain among nurses or the lack of doctors practicing in the community can be an issue under workforce block, and so on. So that whenever we encounter any health issues, we can compartmentalize and organize our thoughts based on these 6 building blocks. So this is a working concept that we laid down to help us understand how we can use art, specifically visual arts, or actually any other form of arts, to adjunctly help in achieving better health for all. So again, this is just an introspection, and anything that I present in this working concept may or may not function in reality. Kasi with the devolved system, magkakaiba tayo ng situation. So this is just a parang conceptual framework on how we view arts as a tool to achieve better health for all. So better health for all, it can be divided actually into better health status, financial risk protection, or client satisfaction. And the context itself here, the context, Those are related to poor access, provision of poor quality health services, or inefficient service delivery. And once you couple that with existing inequalities, so bakit may inequalities? It can be based because of many reasons, and various unresolved social determinants of health, or hindi natin napapractice yung health as a right, it can lead to poor health status. Then eventually, the field of arts can or may serve as an adjunct or supplementary intervention in the hopes that it will result to a more heightened awareness, not just by those who are in the position or authority, but more so what we want is heightened awareness by the people and by the community. So what we want in this scenario is for the artists to create stunning arts that will, again, siguro represent the plights of fellow Filipinos, expose the inequalities, empower, and stimulate siguro the minds of the young, o kung meron mang oppressed, or the poor, or provoke the very entity that needs to be provoked, kung sino man yon na na-identify natin based on our perceptions, and make them accountable for our current health situation. But mind us, this is not to inflict chaos or disorder, but to serve as a stepping stone, siguro, or one of the avenues to start mending those health gaps. Kasi it has been, as I mentioned before, since 1978, battle cry na natin yung health for all. Bakit hanggang ngayon meron pa rin, di ba? Then, at the end, or in the end, we let our viewers, our audience, interpret and relate to their own experiences based on how they are stimulated visually through your artwork. So depende kung paano natin in-execute yung ating output or yung ating obra maestra, depende na sa audience kung paano nila i-integrate yung kanilang own experiences, kung meron ba tayong similarities, commonalities with our experiences, especially mas maganda kung experiences with at the grassroots level. So arts can be used to target specific issue or systemic failure, so that results to poor health status. So for instance, we can use art to express our deepest disgrace regarding the corruption that plagued the COVID-19 response by the country. So years ago, nung nagka-COVID, then lumabas yung mga ganitong issues. If we do not touch kasi on these issues, baka maglaho or matabunan na lamang ito. And true enough, in 2020, I made this pencil drawing on canvas. So this is using graphite and pencil combined, where I equated the corrupt leaders to a teratoma. So teratoma is a form of tumor that invades the natural bodily function. So similar to a young citizen na nagde-decipher paano ba maglaro ng Rubik's Cube, if you know how to follow the patterns in solving the cube, then we can achieve the desired outcome. In this drawing, the cube itself is deformed by the teratoma, and the whole body of that citizen is consumed by the cancer, leading to a systemic failure. So it seems that there are no solution but to remove the teratoma itself, kasi yung cube na hawak niya, hindi na nga rin niya ma-turn kasi iba pala yung shape, may disruptions pala with its form. So I also made an informal narrative on the right side regarding the drawing, which helped me express other inner feelings in the form of writing. So our role here is to create awareness by equating the corruption to a disease plaguing the minds of the people during that time. And again, arts can also be used to expose the plights of a specific population or group. So in this case, our farmers. So when I worked in Nueva Ecija for 2 years as a doctor to the barrio, our farmers have many valuable insights regarding their health that need to be processed. And in this article by Sara de Guzman, she mentioned how agriculture has been a dying field. And beside those policies that are not pro-farmers, what I envisioned during that time was the workforce themselves being affected, not just physically, but mentally and socially. So at that time, I was thinking we need to protect our farmers first and ensure that they receive the right health care. So I began understanding kung ano ba yung mga common na sakit ng mga farmers natin. So for instance, their exposure to NPK fertilizers or their frequent immersion to wetlands result to a common skin disease. But again, treating this disease is easy. But are you going to send them back to the field that they will be exposed repeatedly under the same conditions? So how do we educate them? And I think it is not necessarily just the role of a doctor to provide medicine, but to educate, of course, our farmers. Then how do we resolve this issue? So is medicine that important in this case? Are we going to keep on spending topical remedies for their skin disease? Or is there a more systemic approach to resolve that health issue? So simpleng problema sa balat lang yan, pero kung gamutin mo lang yan, hindi matatapos yung problema. Babalik at babalik pa rin sila na may ganyang kondisyon. So what can the community physician do or what can the government do to prevent this from happening without affecting their way of living? So syempre, alangan namang tumigil sila doon sa pagsasaka para lang hindi magaganyan. So those were the issues at the time. And again, this is a painting I made last 2012 during my medical school days to express the plight of farmers as many farmlands and agricultural lands have been transformed gradually into subdivisions and industrialized or commercial spaces to favor yung mga businessmen and entrepreneurs. So as artists, we can help those particular sectors in the society to voice out their concerns or help them express their desires. As a medical student, then I was very interested in that farmer's story, especially when he stated that para akong sinasakal kapag nakikita ko ang aking palayan na unti-unting lumiliit. So those were his words. And he was pertaining to the lack of patubig in his area, resulting to drought. And when his another piece of land were bought by a businessman for commercial gains. And those phrases by fellow Filipinos, I always record them in my mini notebook as my reference and motivation for my future artworks. So arts can definitely serve as tool to heighten social awareness among the communities. And here is an example of a particular environmental issue, the armyworm infestation that afflicted most of our farmers in Nueva Ecija, which keep on repeating and repeating yearly. So this might be a common issue for some, but with the use of arts, we can enhance the way we view this particular issue. So in that case, I created this artwork entitled Think Tank Crisis. So we know that think tanks are policy-making bodies that create researches to produce a valuable result to help in a particular issue. And in this pencil drawing, we did not specify which think tank are we pertaining. And this is actually a case of a farmer who died from heart attack upon learning that his onion field is heavily infested with harabas or armyworm. So kinwento na lang sa akin nung kamag-anak bakit na matay yung kanilang tatay, na heart attack, sumakit ang dibdib nung nalaman niya na malulugi sila doon sa sibuyas, to the onion farming. And the family blames the fact that no one informed them how to cycle the planting of onions. They have been a rice farmer pero nung nag-try silang mag-onion, wala daw nagturo sa kanila paano magtanim ng sibuyas. They immediately planted onions on their land, hence completing the life cycle of armyworm. So dahil tinaniman nila agad, na-complete yung life cycle ng harabas or the armyworms, leading to the eventual severe field damage. And whoever or whichever those think tanks were, it's up to the viewer to decide. At ang goal lang natin, that's why we created this art, is to stimulate the minds of the viewers kung sino ba yung think tank na nagkakaroon ng crisis at this moment. And again, art can tell the stories of the community. So here is a poor old stroke patient with limited strides. Yung lakad niya sobrang liit na lang, who eventually fell on the ground. So laman lupa, doon sa title, ang paglamon sa maralita ng laman lupa. The laman lupa in the title pertains to many things. It can be our leaders, our national policies, which are not pro-poor, his limited access to healthcare, or our own value system, or even the person's own personal belief and principle in life that may affect the overall health. So these are harsh realities that are being faced by many Filipinos today. And actually, this painting is actually now a property of GSIS. Then arts can also be used for patient education. So we have many kababayans with false beliefs with regard to health. But as artists and healthcare workers, we must not blame them kung bakit ganun na lang ang paniniwala nila. And we must be more compassionate and understanding that these false beliefs are a result of a lifelong experience and exposure to the poor health systems in their area. So ito yung case na nagkaroon ng herpes zoster yung anak ng nanay and nilagyan ng nanay ng lipstick yung paligid ng sugat. Tapos sinabi niya na yung lipstick na nilagay ko, Doc, yun yung nagpigil sa pagkalat ng nana. And when we check ano ba talaga yung nangyayari pag may herpes zoster ang tao, it is really confined on that area. Kahit hindi ka maglagay ng lipstick doon sa paligid, hindi siya kakalat. Pero magtataka tayo bakit may ganung paniniwala yung ating mga community because it has been a practice in one area na naipapasa nila na pag sinulatan mo yung balat, nilagyan mo ng lipstick, hindi siya kakalat. So how do we, what can we do to educate those people? So those community members. So I made this artwork again in 2015 using acrylic in rubber sheet. This is to present the reality in the community that people are so fond of placing penicillin or amoxicillin powder on wounds. So I created this art so that people should know that there are two sides of the story. So one story is that people, despite your advice not to put pulverized antibiotics directly on the wound, they will still continue to do so dahil ito ay tumatalab for them. And you, as their doctor, it becomes a challenge how to educate them that is appropriate to their setting and level of understanding. So we need to level our understanding doon sa level ng ating participants, ay ng ating community members. And the various colors dito sa artwork represent a mold-like image, parang amag, to represent a decaying process, not because we are putting penicillin on wounds, but the decaying process of informing our patient what needs to be done. So there are times we as healthcare providers, nakakalimutan na natin mag-educate, if ever man, sana wag nating gawin yon. And they are inflicted, we as doctors should really spend time and are duty bound to educate our patients. And arts can also promote awareness on chronic diseases. So this is to show how our brain is saved as long as we provide proper care and treatment within the said golden period. So may angel na yumakap dun sa brain. The golden period here pertains to the first few minutes of recognizing the stroke and preventing appropriate medicine and care to prevent long-term damage to the brain. But more than that, the golden period here also pertains to this period in time when we are now encountering more non-communicable diseases such as stroke, heart attack, hypertension, or cancer compared to the previous time. So noong unang panahon, we are dealing with more infectious diseases, but recently, we are now dealing na dahil sa mga lifestyle changes natin, mas nagiging easier for us na maka-access to technology, yung exercise natin nababawasan, so nag-i-increase yung non-communicable disease na tinatawag or chronic diseases. So, yan. And similarly, this is about an individual health and wellness. We can use art to increase our audience awareness. So this is a businessman who consumes packs of cigarettes per day and believes that as long as he has money, he can outlive his beginning shortness of breath. So sabi niya, Doc, wag mo na akong gamutin. Alam ko yung ginagawa ko. Alam ko kung anong meron sa sigarilyo. And he's very adamant about quitting. And in fact, he does not want us to really intervene with his smoking spree and just wanted to complete a physical exam na required ng opisina nila. So basta i-check up mo lang ako. Kailangan ko lang for fit to work na clearance. And because of his refusal to talk about smoking cessation, I cannot do so much but to write his words in my notebook and to serve as my motivation to create this art piece entitled Soon You Will Be Gone. So kasi kahit i-inform mo na so we will encounter those kinds of community members then, no, na even if you really educate them, medyo adamant sila and we don't blame them bakit sila ganon. So siguro nga sabi ko kanina, part of that is the living environment natin na medyo hindi na conducive for healthy lifestyle recently, especially nowadays. And again, this is a COPD patient or chronic obstructive pulmonary disease, a form of a disease of the lungs, who keeps on smoking since his teenage days. So how I interpret the statement of the patient during my conversation with him was very enlightening because even if he did not outright tell me na gusto niyang gumaling, I know for a fact na gusto niyang gumaling. Pero kasi at that time, huli na yung lahat. And his COPD was severe that he needs a constant oxygen supply and nagkakaroon na siya ng frequent readmissions due to pneumonia. And what struck me most was the fact that he blames the public officials who continuously smoke in their workplaces despite the Executive Order 26. The Executive Order 26 prohibits yung smoking in workplaces and designates a smoking area na doon sa workplace natin. So the patient wants to rip apart his lungs, parang gusto na daw warakin yung kanyang lungs, but in reality, can we blame him for his act? Pagagalitan pa ba natin yung ganitong pasyente, or do we have the right ba na pagsabihan pa yung ganitong pasyente when in fact it is the very system na nag-allow sa kanya na mag-smoke. So sabi niya, seeing government officials smoke in public kahit may batas, yun yung naging motivation niya not to stop smoking. So medyo masaklap yung nangyari sa kanya. So at that point, who should we blame? Bakit naging accessible sa kanya ang Yossi? Even if nung bata pa siya, bakit nagiging accessible despite the law or the executive order? So those are the societal issues na medyo dapat napapansin din natin as an artist and at the same time in the medical field. And we can also use art to plainly promote certain advocacy such as population health. So this is a painting I donated at Rizal Medical Center at the OBGYN department last 2017 to show our appreciation on their efforts to curb maternal mortality. So by providing quality health services dun sa mga buntis, mga nanganganak at tapos ng mga anak, malaki yung naitutulong nila para mabawasan yung maternal mortality. So we gave them a small token of appreciation using a painting. And even on the topic of gender sensitivity, we can also utilize art to normalize and remove stigma among several genders emerging nowadays. So ang health naman, di lang naman yan related to certain diseases. Pwede natin ipasok ng several issues sa society, including gender stereotyping. So we can use art to remove gender stereotyping in short. So this is a commissioned painting which I painted last 2019. And lastly, we can use art for awareness on our current health system itself. So this is a teenager with leukemia patient or a leukemia patient with blood cancer that experienced difficulty obtaining blood, which eventually resulted to his demise. Access to such service became so difficult that the patient wanted to end his life. So his parents have been to several hospitals looking for blood donors, but a few bags wouldn't be enough to support the teenager. So in this painting, I based this from the perspective of the patient to help him express what he really wants in spite of the leukemia. So sabi niya, he wants to be free, he wants to end his life na daw dahil wala rin namang saysay na kumuha ng dugo. Kung kulang naman yung dugo, paano pa rin siya mabubuhay? So he wants eternal bliss because it has been costing them a fortune to look for blood donors talaga. So medyo masaklap, wala ka rin namang magawa as a community physician at that time. Pero we help them navigate through various hospitals. Pero at the end of the day, the system itself is medyo hindi pro-patient minsan. So ganun yung nangyayari in reality. So again, I want us to become familiar with these social determinants of health that may help us create more arts for awareness. But remember that when we do art to expose societal ills, it should be a real issue. Hindi pwedeng gumawa tayo ng sarili nating problema na hindi naman na-encounter ng ating mga kababayan. So in order to do that, we need to live and be part of our own communities. So we need to understand how our communities battle with specific health determinants. And we as artists, we can start with identifying yung mga social, political, and economic. Even if yung tatlong yun lang, social, political, economic climates within our area, pero at the end of the day, is awareness enough? So that is why art can be a powerful tool to convey a message to society. So it can increase awareness by the community, but more than that, it can create movements that show support or disgust in a particular issue so that it will be immediately addressed. But again, we do not create art just for inflicting chaos or disorder in the society. Ang gusto natin, art to stimulate the society na aksyonan kung ano yung ating problema, na mas maganda kung yung pinaka root cause yung ating matutumbok. And for example, this artwork of mine is motivated by the fact that many people do not take stand with regard to the EJK during the height of the Oplan Tokhang. Some did not consider them as EJK, or for some, they agree with EJK to extinguish the looming drug menace in the society, with little knowledge that drug abuse is also a public health issue. So, kung may EJK na issue that time, ang mas focus natin during that time is the public health impact of the drug abuse. So, isinantabi si EJK pero mas tinutukan natin ano ba in a public health perspective or in a community medicine perspective, paano natin matutulungan yung mga na biktima. And true enough, after we interviewed around hundreds or 300s of drug surrenderies during that time, lumalabas na poverty is one of the reasons bakit sila nagsumusubok ng droga. And they stay awake driving trucks and tricycles, delivering goods from Nueva Ecija to Manila, for instance. Dahil doon, kailangan nilang sumubok para manatiling gising. May mga ganong issues pala yung ating mga kababayan na minsan hindi natin napapansin na mas kailangang i-address kaysa mag-proceed to more stringent measures. So I also expressed in this drawing how taking the life of one person can also ruin the life of relatives, the children, and their dreams in the future. So art can be a tool to expose how poor becomes poorer and rich becomes richer. And this is relatively a calm and relaxing painting that depicts a slum area versus the distant industrialized area. Although for some, they are aware of their poor living conditions, they still remain voiceless, probably due to lack of trust with the system, probably because of learned helplessness. We do not know for sure. And again, based on the Alma Ata Declaration, the people have the right and duty to participate in the implementation of healthcare, regardless of their current status. So kahit medyo may kapos tayo, kulang tayo sa budget, sa pang araw-araw, kailangan ang tao nagpa-participate. And for those who are voiceless, through arts, we can help them. And for those who are oppressed, we can still help them to express again through arts. Because art immortalizes their plights, or immortalizes the plights of our fellow Filipinos. So after I presented to you some of our artworks, let us proceed to the process of making those visual arts that we believe have roles in improving the health status of our nation. So the process starts by recognizing the fact that in a community, at times, it is composed of disadvantaged population. At times, or most of the time, they may be powerless, and at times it may have poor organization, or at times there may be proliferating social injustices or inequalities, and with imbalance in power. And so in order for us to gain our motivation, we must first engage with the community. We need to immerse, live with them, eat with them, cry and laugh with them, among others. And because understanding the people alone is useless if we do not understand the community dynamics themselves. If nakausap mo lang yan sa hospital pero hindi mo alam kung saan nanggagaling yung pasyente, kung ano yung tinitirhan niya mismo, mahirap mag-advise, magbigay ng advice sa pasyente. Similar to that, before we create artworks, we need to empathize with them. In this picture, we are understanding the stories of parents with child afflicted with depression and schizophrenia. And the bottom part of the picture shows the community leaders in Tondo also sharing their plights as they protect their own land against commercial exploitation. So I'm sure na sa news naman yon yung ano yung nangyayari doon sa mga areas in Tondo na ginagawang kino-commercialize. So merong mga taong affected at the time. So kailangan nating maintindihan ano yung pinaglalaban nila before we create artworks. And along the way, we may proceed with community participation and community organizing. So in this step, we can gauge how well do our communities learn and assimilate the knowledge we are imparting with them. And at the same time, not just we giving them knowledge, but us learning from their practices, ano yung mga nakagisnan nila. And we also contribute to their activities so that we can build more rapport and relationship in the end. So pag ang area kulang sa dugo, we try to donate blood. Kung merong issue on rabies, we educate them on responsible pet ownership, etc. And we need to get to know the leaders as well. So hindi din pwedeng puro community members. Although pro-tao tayo, syempre, at the same time, we need to engage our leaders and stakeholders so that we can strengthen their health advocacies and link them to those who were unheard before. So we need to know which institutions we can tap to help the community advance their health agenda. Minsan kasi akala natin if nakapagpahayag na ang isang leader sa harap ng maraming tao, ay naintindihan na ito ng tao. But not all the time, ganun yung nangyayari. Ang tanong ay pinakinggan mo ba mismo yung tao? So that's why we are engaging the leaders as well. And in this picture, I am challenging the Anao artists in Tarlac at that time on how they can use art as a tool to empower a community, to send a message to the accountable officials, for instance, or even for their personal reflections and introspections regarding the state of the current health system. In this step also, we are also involving more sectors. For instance, this is about blood donation program in one municipality. So tulong-tulong, kung sino yung pwede nating matap, paano makakatulong sa isang komunidad, mas maganda. And as we gain our understanding with the community, we are beginning to balance our service with learning. We need to provide proper healthcare to those who have poor access, help them navigate the complex healthcare system of the country. And the picture on the right is screening for minor surgeries dahil medyo poor yung access sa surgical intervention. Kailangan naming ma-screen sino muna yung mga mauunang ipapadala sa ospital. And whenever inspiration and whatever inspiration we gain from them as we learn, we always give back to our community. So in these pictures, several artists joined hands to support healthcare workers for providing PPEs, provide art therapies to soldiers, and provide community service by making meaningful and insightful murals to advocate health and wellness. So, mas masarap sa pakiramdam na gumawa ng artwork kung ito ay galing mismo sa experience mo at experience ng iyong komunidad. Then we continue educating the community. So this is in Tondo Urban Community where we are providing an overview of the national health system, the community leaders to further broaden their knowledge and consciousness with regard to their right to health. And upon serving, we also alleviate the fears of the communities. So this is in Laguna where we provide series of family meetings for those who complained about the issue on Dengvaksha. So my point here is that before I create artworks, I make sure that I also serve the community from which I gained my understanding, learned my lessons, and to the community who inspired me to further advance our health advocacies. And as for me, I always find my motivation to paint and create art pieces from the stories of my patients in the community. They serve as my inspiration to continue my service and advocacy. And as we create the artwork, we are also letting the societal issue linger and run into our mind over and over again so that we will have a wider perspective and possible ideas on how to help that particular patient of ours. So kumbaga habang nakakapagmuni-muni tayo habang nagki-create tayo ng artwork tungkol dun sa mga na-experience natin sa community, yung mga pinagdaanan ng mga pasyente po natin na habang nagpe-paint tayo, na pagmumuni-munihan natin at mas nakakapag-reflect tayo along the process. And we need to do this, we need to paint more because art, it immortalizes those systemic failures so that we will never forget those times and so that we will be held accountable with one another. Because with art, aside from body healing, it is for healing of the nation. And so art to change the system. So kanina ko pa sinasabi na art in changing system. How do we do that? So we always ask ourselves, and this is still part of the process, no? We ask ourselves, what is the public value of that particular event na nakikita natin? And what is the root cause? It's important kasi baka naman hindi pala root cause yung gusto nating i-express. What are the societal ills that affect the community? And the last one, who will change the system? And the last question is one of the most difficult one to answer. Who will change the system? So, sagot dyan, everyone must be involved because you cannot do it alone. Even artists can be involved in changing a system, more so if these are collective efforts. So, maganda kung individually nakakatulong tayo sa pag-express at pag-present kung ano yung nararamdaman ng ating kapwa, pero mas maganda kung ito ay collective efforts. And of course, if you work alone, this cannot be achieved fully. That is why I am also encouraging everyone to become artists in their own ways. So whether you are into music, you are into poetry writing, or even art appreciation man lang, it's important that we integrate them to our society and to our community, what we are experiencing now. So I invite everyone to be more familiar with the systemic illnesses that plague the nation, specifically in my case, I am more inclined into the health issues. And I invite everyone to make meaningful arts that promote social awareness, health, and wellness as well. And in fact, there are numerous avenues for us to present our outputs. We are thankful to the organizers of art events, these kinds of talks, and we have our institutions and universities to thank for, the social media platforms, numerous art galleries and museums, even art spaces, or kahit nga sa tabi, mag-set ka lang ng art exhibit, for providing the opportunity to expand the advocacy on health and wellness. And collaborating with various artists and organizations as well is a useful step. So now going back to the working concept I presented a while ago, I realized that one of the missing pieces is the change agent or the catalyst. So without those unique change agents or advocacy, our advocacy for better health for all will not push through. So sino ba tong mga change agents na ito? Siguro sa kayong marinig, ano ba yung mga lagi na lang namin narinig. Pero again, anyone who is aware of the agents. So it can be you, it can be me, it can be everyone. Regardless of our field of practice, everyone can start their own advocacy and start integrating arts in their practice. So if you are an engineer, probably you may have introspections too that can promote good engineering practices with the community or people at the center of the advocacy. So depende sa mga fields of practice natin or kung ano man yung ating nakasanayan na gawin or saan man yung ating passion, we can always integrate art with that. And in my case, in the medical field, I start asking why not integrate arts in the field of medicine, especially in the medical curriculum. So iba yung art of medicine sa arts in medicine. So it has been done on various countries already with promising results. So this is a work in progress, pero we are trying to advocate the integration of art, even art appreciation man lang, into the medical curriculum. So this is also one of my advocacies, the intersection between arts and health and medicine resulting to medical humanities. And medical humanities has been a term ever since noong una pa man may medical health humanities na rin talaga. Pero hindi lang siya nabibigyan ng pansin because we are so into technologies, we are so into innovations that will enhance the field of our practice. Pero more than that, we want na i-involve ang ating mga pasyente, ang ating community doon sa proseso ng paggagamot sa kanila or paano sila gagaling dito given the current health system na meron tayo. So this is a work in progress and we need more artists to expand this advocacy of using arts for better health for all. And as I end my talk with this artwork, I made this last 2020 that shows a young government employee who eventually died of invasive breast cancer. So before she died, I had a chance to interview her and learn from her insights. So she reiterated how she was not able to advance her career as an administrative aide because she was not able to finish high school. And working as an aide gave her siguro as a glimmer of hope that someday she will earn gradually as she continues to serve. So sabi niya, the more siguro na magstay ako dito sa government na to, the more na ma-promote ako eventually. But upon her diagnosis of breast cancer, it reinforced her inner thought that she has been dead since she was born. So na-realize niya, with this kind of health system sa bansa, pinanganak ka pa lang, patay ka na. Ganun yung sinabi niya. And she has been a victim of a poor health system. So dahil nakita niya na gaano nahihirapan, sabi niya, gaano nahihirapan ang taong bayan sa kasalukuyang sistema, ika niya, this became my constant reminder for me that if we fail as a system, everybody will ail and will succumb to infirmity and death. So with that, thank you for, I end my presentation and thank you for listening.
And thank you so much po, Doc Nico, for that very insightful. Ang rami ko pong natutunan. It's very enlightening, your talk. Doc Nico, I'll let you rest for a while we look at the next sessions that we might have here in TLRC in collaboration with Makisining.
Okay, thank you, ma'am.
Okay. Session is presented as when system fails, everybody ails. Our next speaker for the week after, that's February 28, 2024, will be Mr. Paul Benjamin Hilario. Paul Benjamin Hilario is one of the senior artists that we have at Makisini. He's one of the founders, just like Doc Nico Sidicol. And he will be speaking about his artwork and being a science or STEM professional before moving towards art as a profession. So hopefully he will be here with us on February 28th as well, as we listen to Mr. Paul Benjamin Hilario in his art talk. Okay, if you have any question, kindly send in your question through the Q&A box. We have a Q&A box right at the bottom. One of the icons at the bottom, it says Q&A, and then you can encode your questions over there for Doc Nico. I do hope that a lot of us were able to learn so much from his talk. Me as well was able to learn so much from his talk. Okay. So there are some questions coming in. Doc Nico, are you good? We'll
Yes,
pin you out. We'll pin you here. Spotlight. Okay, the first question is, good afternoon, Doc. Is there a concrete way in curing depression? So I think they are talking about art therapy and mental health on this matter, Doc Nico. Do you have any insights about this?
Okay, so thank you for the question. So the question was, is there a concrete way for curing depression, right? So actually, the
Is there
depression,
a concrete way
mm-mm.
about is there a
So,
concrete way of doing art to cure depression
ayan.
or
So,
therapy?
well, ang sakit po kasi na depression, it can be emotional, it can be the one, the psychiatric depression na talaga, or yung the one that leads to na kailangan mo na ng medication. So we really assess the patient first kung at anong level nung depression, probably baka nasa mood problem, sleep problem na nagli-lead to parang depressive episodes, or if this is a full-blown depression. So there are criteria that we check before we diagnose depression. And along all those spectrum ng depression ng ating mga kababayan, we can integrate arts pa rin naman. It may not be definite cure or definite treatment for them, but at some point, sabi nga natin, pag nagagamot tayo, multifactorial dapat yung ating mga approach sa pasyente, hindi lang medicine yung tinitake. So art therapies can really, and actually it has been, there are studies that proves how art therapies can improve yung overall well-being of the patient. Pero siguro ang important dyan is how do we assess again that patient kung ano yung perspective niya after receiving that art therapy session. So kung nag-improve man yung kanyang well-being, then we can continue on that. Or baka mamaya need na pala niya ng gamot talaga. So at some point, minimix na natin yung approach on or our plan or management for the patient. So, good question po kasi bibihira minsan din po in the medical field siguro kailangan talaga ng conscious effort to organize an art therapy for those patients or kababayan na may depression. So, siguro, initiative siya ng mga institutions dapat or organizations and we can advocate for that naman. Wala namang masama na mag-art therapy sa mga kababayan natin.
Thank you po sa inyong insights, Doc. And I'm also very thankful that because of the more widespread education regarding mental health, especially after the pandemic, we are now more aware that there is such a thing called depression and it's real. It's not just about gaya nung sinasabi ng ating mga parang nalulungkot lang yan, parang ganyan. Pero it's actually a real thing and it can also be addressed as long as we have good healthcare providers as well as good avenue for healthcare with regards to this issue or healthcare issue. So thank you for that, Doc Nico. There are also some messages for you, by the way, here. I will just read a little bit of those. Doc Nico Sadico, thank you so much. Thought-provoking po yung ginawa niyo, reminds us of why we are in the healthcare. Thank you beyond words, Doc. It's very inspiring. God bless you po. Your work of art speaks volumes of your tender love and care. Thank you for sharing your knowledge, and it is helpful to my personal growth. And you being our speaker for the webinar today, congratulations to all of us. Then, Doc, how do you think po med schools or allied health schools can start integrating medical humanities in their curriculum? This is a good question, actually. What could their starting point be? So, I think
Actually,
na
question ko
nakita
din
niyo
yan.
yung ano yun.
Oo. So thank you for the question kasi question din siya actually ng mga advocates natin for health medical or health humanities. And actually we are gearing towards health humanities to involve yung mga allied professionals as well. Kasi pag sinabi nating medicine, minsan doktor lang or doctor-centric masyado, nadidisregard yung ibang allied health professionals. But what we want is health humanities as a whole, then involving yung mga different allied medical professionals. So, what we see for this to advance yung advocacy na yan is to create a pool of artists, not necessarily in the medical or health field, but pool of artists, but those with the same advocacy in mind. So, even if you're an artist from ibang bansa, siguro kung may similar tayong advocacy to improve health and well-being, pwede namang maturuan yung ating mga medical students and kasi it has been proven with other countries na nag-start na ng ganitong movement na when you integrate medical or health humanities in the medical curriculum, sabi nila, mas nagiging compassionate daw yung mga doktor, mas nagiging aware, mas better yung understanding kung saan nanggagaling yung ating mga kababayan, mas hindi mainitin siguro yung ulo. So, important siya na ma-involve lang din. Kahit isang subject lang siguro. But the process is, sabi ko nga kanina, parang work in progress kasi it will dadaan yan sa maraming levels then when you integrate a subject in a medical curriculum. But the starting point will be to join, we would like to enjoin everyone siguro na magkaroon ng similar advocacies. actually not just health, kung sa ibang field, sabi ko kanina, kung sa engineering, environment, basta magkaroon lang tayo ng siguro ng niche or certain focus areas na pwedeng matutukan, then we can integrate arts naman.
Yes po. So, gaya po nung sabi ni Doc Nico, it may start from advocacies. And since malayo-layo pa po yung dadaanan nung change na yun, especially when you want it incorporated in the curriculum in the medical fields and allied medical fields, eh, pwede po tayong mag-start as individuals and call for advocacies. Sa amin naman po na for teachers like me, ginagawa po namin yung service learning ng mga bata, yung pagiging parte nila sa para ipakita ang mga different advocacies na pwede nilang pasukan in tune na rin sa ating mangyari na sila rin ay aware sa pagpupush ng mga bagay na ikabubuting na sa ating komunidad. Okay, so ganun. Meron po tayong isang question dito from the Q&A box. Productive talk. Creating that between the arts and healthcare in the context of your process is emotionally moving. My question is, how much has your art changed your approaches in doing your medical practice? And what are some of these changes that you have noticed? Ayun, personal po ito, Doc.
Medyo ano na, oo. So thank you for the question again. So actually I started painting para kumita and para magkaroon ng additional income noong mga high school days, college days. Pero siguro dahil na-expose na rin ako sa communities, various communities, doon ko nakita na may gamit yung art para yun nga, sabi ko kanina, mag-advocate ng something doon sa komunidad. So nag-change na siya, naging hindi ko na focus yung although syempre nag-create pa rin tayo para for aesthetic purposes, mag-design ng mga living room areas, we paint that, may nature pa rin tayo na ginagawa. Pero more than that, nagkakaroon kasi ng purpose yung ating paggawa kung meron tayong tinutumbok na outcomes na gusto nating makita, which is more systemic in nature, and sabi ko nga healthy yung naging ano natin. So nag-change na siya. Medyo mahirap masabi eh. Parang it should come naturally na lang din eh, na kasi pag pinilit mo rin yung sarili mo, kagaya ngayon recently kung marami masyadong ginagawa sa hospital, hindi ka rin maka-create ng art, pero what I do is I write them in my small parang diary or notebook. Pag may nagandahan ako na kinuwento ng pasyente or ng community member, naglabas siya ng kanyang insights or hinanaing or problems in the society, I always take down notes. And minsan nagpapaalam ako, ma'am, ang ganda ng sinabi nyo. Okay lang ba na minsan i-translate, I will translate your words into artwork. So, or for instance, meron siyang experience na kinuwento, at times nagpapaalam din ako na, ma'am, okay lang ba na i-drawing ko yung ano based on my interpretation or based on my paano ko na-assimilate or naintindihan yung pagkakasabi niya. And those were the important kasi habang sinusulat ko rin yung mga stories nila, nare-remind ako doon sa ano ba yung mga dapat ko pang i-advocate. So like right now, I am focusing din sa mga smoking cessation kasi one time naglalakad ako doon sa may DOH mismo na central office sa may Tayuman area. Tapos may naninigarilyo doon na mama, nagtutulak siya ng kariton. Out of nowhere, bigla ko lang tinanong bakit naninigarilyo. Tapos sabi lang niya, to relieve yung gutom. Tapos hindi naman siya nakakaramdam pa ng hirap sa paghinga. And nandyan lang daw naman yung Jose Reyes na ospital. So kung mahimatay man daw siya o mahirapan siya huminga, alam niya na tatanggapin siya ng ospital. Pero tingnan natin kung ganun ba talaga yung mga. So at that time, medyo nag-aano rin ako talaga sa smoking cessation siguro kasi laki ng impact niya talaga sa health ng tao. Pero more than that, hindi rin natin masisisi yung mga tao na nagsusmoke talaga. We try to understand them saan nanggagaling yung ganung Di naman natin masabing misperceptions, pero yung ganung practice nila. And from that, we create art to advocate. And again, sabi ko kanina, based on the audience na lang kung paano nila i-assimilate yung pagkaka-execute natin ng art. So kung sa tingin nila na provoke sila, maganda. Kung sa tingin nila na masyado namang OA yung ginawa na art nito, ganyan. So it's up to them naman to decide kung paano sila maapektuhan ng artworks. That's for my own ano lang din. Views.
Naalala ko tuloy yung sinabi mo kanina na systemic yung problema, especially nung nag-talk ka about sa drogas. Na hindi lang yun desisyon ng tao dahil gusto niyang gumamit ng drogas, dahil na rin yun sa mga epekto ng iba't ibang parte ng kanilang paghahanap buhay, yung komunidad nila, yung klase ng trabaho. Maraming mga bagay ang nakakaapekto. Bakit nagdesisyon silang gumamit nun? So, gumamit ng drogas or gumamit kaya or papanigarilyo. So, yun, systemic pala yun. So, doon marami ako nakuha rin sa iyo, Doc. Dahil kailangan ko rin yun as teachers para maibigay ko rin yung mga impormasyong yun sa aking mga estudyante. At mas mabuti yun kasi if sa pagiging estudyante pa lang alam na nila ang mga bagay na ito, mas maintindihan nila later on, paglaki nila, kung anong mas magaling or magandang gawin bilang parte ng komunidad. So,
And
yun.
actually, I also encourage kung may mga else on social sciences, anthropologies na doon din nila ihayag kung ano talaga yung tunay na situation. Kasi kung minsan kung arts, it will depend on the interpretation of the audience. Pero kung yan ay evidence-based, meron kang methodologies, nag-randomize, control ka, etc. Mas may substance siguro yung ganong systemic issues. And I think there are several journals na rin naman with regard to drug abuse, bakit gumagamit yung tao, ganyan.
Opo. Yay. Salamat po sa inyong mga binibigay na suggestion ngayon. Pong natutunan namin actually. On my case kasi social science kami, being in education. Ang grabe ko rin na parang pumapasok na input sa akin, being a basic education teacher as well. So,
siguro wag kang mahiya
meron po
mag-immerse
tayong
sa community. Yan.
Oo. Totoo. Meron po tayong I'll just read a little bit of the messages. Doc, we totally agree how art makes us more human and compassionate, and would love to see this pool of artists come together in the near future. Also, Doc, they are thanking you so much for a very good, very enlightening talk for today. We also have one question, a few more questions if it's okay for you, Doc. Are you still okay to get 2 questions more? Is that okay? Okay. So, the first question, thank you so much for the very insightful presentation, Doc Nico. May I ask, how can communities be involved in integrating arts into healthcare? So, I think being a normal citizen, maybe yung sa community natin, paano po ba natin mai-involve yung communities in integrating arts to healthcare?
Okay, so actually magandang gawan din yan ng isang conceptual framework din siguro. Pero thank you for the question, no. Yeah, yung pag-involve ng community mismo, I think it will magkakaroon pa yan ng process kasi kung paano mo sila i-involve. So it may start with awareness, then siguro pag may na-trigger, etc., it will become ano na sa kanila, inherent or innate na sa kanila na ma-involve. Pero with that, we don't want din kasi when we go into communities, we don't want to impose something, we don't want to, eto gawin ninyo to, ganyan, ito ba yung nararamdaman nyo, sige gawa tayo ng ganito. We don't want that to happen. So in a community, what we want is to really understand saan nanggagaling, and dun na lang tayo papasok sa kung anong stage man sila. Kung nasa stage sila na medyo watak-watak yung organization nila, then probably we can decide how can we use art to integrate them. So especially kung may mga cultural practices sila, halimbawa, paano natin mas-strengthen and mapopromote yung mga practices na yon through arts. So pwede tayong pumasok doon. Then eventually kung medyo nagkakaroon ka, nakakita ka na ng mga may parang community leaders to or parang pwede tong itap or pwede tong isama sa mga meetings halimbawa kasi try nating isama. Then eventually pag nakuha natin yung insights nila, then we can involve them gradually. Then what we want at the end of the day is for them to stand alone on their own na. So na-impart mo na yung knowledge, naturuan mo na sila, then eventually, sana sa kanila na mismo manggaling. So kung arts man yan, as an advocate, pwede natin silang tulungan na mai-express yung kanilang nararamdaman through arts. So through pakikipagkwentuhan, pakikisalamuha sa kanila, then of course with consent from them, we can express our kung paano natin na-interpret yung kanilang hinanaing. Then pag mag-feedback naman, usually ang community kailangan mag-feedback yan sa ginawa mo. Yan, pag nag-feedback sila kung nagustuhan nila, then we can let them involved na along the process or along the way. So medyo mahirap siya or medyo complicated siya na task. So baka kasi lumabas na bigla ka na lang pumunta doon, nag-art advocacy, pero hindi pala gusto ng community. So
Mm-mm.
kaya ko pinakita kanina sa process na kumain ka muna with them, build rapport with them, understand saan ba nanggagaling yung kanilang health issues particularly.
Ayun. So, communicating with the community is vital in building up this advocacy within that community. Nakita ko rin yung di ba daw kanina, nakikipag-usap ka sa yung grupo na Anaw sa Tarlac ba yun, Dok?
Yes po.
So, being with them and talking to them, communicating with them properly on what to do. So, um, also yung mga stages, na-appreciate ko po yung answer niyo, Doc, regarding the stages na tinitingnan mo kung saan sila ngayon. At parang ginagawan mo ng trigger point kung saan mai-encourage sila na i-build pa more yung kanilang na-start na or na-initiate na pagkakumpul-kumpul o pagkagrupo nila. So, thank you po sa insights na yun, Doc. Last question po, Doc. Good afternoon, Doc. Do parents, for example, in drug addiction, one thing I believe drug addiction can be traced back to parents who also failed as parents. So, ano po yung masasabi niyo regarding this matter?
Yeah, actually,
Sa
Mhm.
sa amin po kasi, Doc, when it comes to education, we know that the first educators of their children are their parents. So I think it would also trace back to this particular question.
Actually, oo, no. Actually, buti na-mention nila yung family pala. Actually, hindi ko yan siya nasama sa mga slides natin. Pero the role of families doon sa, syempre, di naman pwedeng tayo lang yung nagbibigay na information sa kanila. So, iba din kasi yung dynamics ng community, iba din yung dynamics ng family, iba din yung dynamics ng individual interacting with the family and the community. So dun sa question na yung families na diyan nagsisimula, yung siguro pag-educate natin, medyo iba rin yung approach when it comes to families because medyo gitna siya ng society natin. We have the government, the LGUs, then you have yung mga individually affected. When it comes to families, iba-iba yan sila ng perceptions or iba-iba yan sila ng gustong mangyari. And depende rin sa stage ng family ko, ito ba ay nasa stage na sila ay humihiwalay na dahan-dahan yung anak. Hindi rin kasi tayo pwedeng mag-impose sa family na ito yung gawin ninyo, i-educate mo siya. So siguro we can provide family art therapies as a family or as a whole in the hopes na ma-assimilate nila yung message na gusto nating maibigay sa kanila. Pero yeah, iba yung ang point is iba yung approach siguro pag families. We can do family therapies as well pero in more on educating them na lang siguro. Kung nandiyan na yung abuse, nandiyan na yung drug abuse within the family, medyo fino-focus muna natin yung immediate impact ng abuse, ng pagiging siguro drug user ng person, then tsaka tayo papasok na lang with the arts to as an adjunct or supplemental doon sa major treatment natin. Kasi once may drug user din sa family, medyo affected din yung mind or yung the way na mag-decide yung family. So mahirap din basta-basta ka lang mag-art therapy or mag-ano sa kanila. So we try to counsel them first or provide counseling techniques paano ma-address yon. Then siguro, tingnan natin kung paano makakatulong ang art for them.
Thank you. Thank you po, Doc. So, oo nga po, Doc. Medyo nakafocus po ata sa community yung kanina. At saka it's a good insight po na meron pa rin tayong magagawa on the nuclear level, which is actually the family.
Yeah.
Ayan.
Maganda i-integrate din yun or i-include next time.
Okay. So, I think that's it for now. There is this one question, but I think we would like to just answer this as quickly. How can we balance technology and pursuit of art? Children spend so much time with their gadget and less painting and singing. I think with the onset of ICT and technology right now, there are different kinds or ways that children are encouraged to do art and not just doing traditional art. And I also believe in that because being a teacher and doing art stuff, um, the answer here is how will you be able to make sure that your children do things with technology at specific periods of time, and what encourages them to use technology for a specific purpose. So this goes back to how parents actually help their children understand how to use a technology and what is it for. So that's actually an education question over there. Okay. So, Doc Nico, pahinga muna tayo. I will just wrap up some of the parts of our talk today before we give Doc Nico his certificate of recognition. So for today, the main idea is that we artists and budding artists have the capacity or have the power to actually call to educate our community and to call for the good of the people and to change the current system for the better. We can also be catalyst for change. Artists can also be involved in changing a system through collective efforts. And being more familiar with the systemic illnesses that plague our nation is the best thing we can do to start our advocacy and our yearning for the betterment of our people. So we need to use arts for better health for all. That's some of the parts of the talk of Doc Nico that really impacted us and has given us more insights. And we also need to remember that in our communities, poor health options and conditions would always lead to poor patient education, poor access to proper health care, poor community health care and health education, and poor awareness on individual health and wellness. And there are a lot of factors that contribute to all of and society as a whole in the context of health. And that includes societal factors, political factors, and also economic factors. And as people who do art, we have the power to call for higher awareness regarding these matters. And it may be it may be best for us to understand more about the various building blocks for the healthcare system in each country. That would include leadership and governing health workforce, medical products and vaccines, and health information system. And these are just few of the things that Doc Nico was able to impart to us. So for us here at UP Cebu TLRC, in collaboration with Nakisining, I hope this webinar has given everyone a good insight on how art and how health is intertwined. And we have power by using art. Let me call on Sir Nan Bernardes and Doc Nico Sedecol for the certificate.
Yes, thank you so much, Miss Jara. Actually, I would just like also to add some actually add my sentiments regarding the talk with Dr. Nico earlier, that especially for us teachers, um for those focusing on integrating arts and health to better understand our students specifically inside the classroom. So this webinar would really help us teachers to understand more our students. Also, I think right now I will go ahead and share with you guys the certificate, the virtual certificate. I would like to express my personal gratitude virtually to Dr. Nico Sidicol, MD, MPM, and also the Makisining artists for collaborating with UP Cebu TLRC. And we're hoping that these webinars will ignite the enthusiasm of all art enthusiasts to start creating art right now. So I'll be sharing with you guys the certificate of appreciation. Just one moment. Appreciation is actually provided, it's given to Dr. Nico Sidicol, MD, MPM, for sharing his invaluable time and expertise as a resource speaker in the webinar on When Systems Fail, Everybody Ails, Art Towards Better Health for All on February 20, 2024 via Zoom, given this 20th of February 2024 at UP Cebu, Lahog, Cebu City. Signed by yours truly, Sir Nan Bernardes. And again, sir, thank you so much for sharing your expertise and your love with art, sir. Thank you.
Thank you. Thank you, sir. Thank you, ma'am.
Thank you so much, Doc Nico. Okay, before we end our talk, let's have a photo opportunity with our speaker. Um, okay. Maybe we can turn off already the YouTube live for this one.